We're talking about health care today, and which plan do you support? Obamacare or the Affordable Care Act?
The Affordable Care Act.
And what is it about Obamacare that you do not like?
I just think that there's a lot of holes in it, and it needs to be revamped. I think
And you think the
hasn't been thought out.
You think the Affordable Care Act is a better plan than Obamacare?
Better, but I'm not happy with that either.
What do you agree with, Obamacare or the Affordable Care Act?
I'm more towards the Affordable Care Act, but I'm also very sympathetic for people that don't have the ability to have proper medical insurance.
So the Affordable Health Care Act is still a better option than
Yes.
Obamacare?
Yes.
And why do you not agree with the Affordable Care Act?
Well, I think it's not really available for all.
So the Affordable Care Act is more affordable than Obamacare?
Just the name says it all.
Right. You would agree with the Affordable Care Act?
Absolutely. I think it's nice that everyone can afford it, and everyone should be able to afford it, but to force people to pay something and then doctors to make something, limiting their ability to do their job, that's kind of anti-American.
Right. So Obamacare is un-American?
I think it's kind of un-American to force people. What if they can't afford it? What if they want more coverage?
And the Affordable Care Act is American?
I think it's more American because it allows people to make their own choices on what they want and who they want to work with.
Do you agree with the Affordable Care Act or Obamacare?
The affordable.
And why do you prefer the Affordable Care Act over Obamacare?
I just don't agree with the whole Obamacare policy thing that's going on. I just don't agree with it.
And do you believe that an informed citizenry is essential to a democracy?
Yes.
So you disagree with Obamacare?
Yes, I do.
Do you think insurance companies should be able to exclude people with pre-existing conditions?
No.
Do you agree that young people should be able to stay on their parents' plans until they are 26?
They should be able to, yes.
Do you agree that companies with 50 or more employees should provide health care?
I do.
And so by that logic, you would be for the Affordable Care Act?
Yes.
What plan do you support, Obamacare or the Affordable Care Act?
The Affordable Care Act.
And why do you support that over Obamacare?
Do not like Obamacare. I don't like anything that has to be forced for everybody to buy. This is not good.
Do you think Obamacare is socialist?
Yes, I do.
Do you think the Affordable Care Act is socialist?
No.
Do you believe that Obamacare will eventually lead to gun prohibition?
Yes.
Do you know that Obamacare and the Affordable Care Act are the same thing?
No, they're not. Thanks, you made me look stupid.
It's what we do.
Okay, you did good.
Here are the details that every American needs to know about this plan. First, if you are among the hundreds of millions of Americans who already have health insurance, nothing in this plan will require you or your employer to change the coverage of the doctor you have. Under this plan, it will be against the law for insurance companies to deny you coverage because of a pre-existing condition. As soon as I sign this bill, it will be against the law for insurance companies to drop your coverage when you get sick or water it down when you need it the most. They will no longer be able to place some arbitrary cap on the amount of coverage you can receive in a given year or in a lifetime. We will place a limit on how much you can be charged for out-of-pocket expenses because in the United States of America, no one should go broke because they get sick. And insurance companies will be required to cover, with no extra charge, routine checkups and preventive care, like mammograms and colonoscopies, because there's no reason we shouldn't be catching diseases like breast cancer and colon cancer before they get worse. If you lose your job or you change your job, you'll be able to get coverage. If you strike out on your own and start a small business, you'll be able to get coverage. We'll do this by creating a new insurance exchange, a marketplace where individuals and small businesses will be able to shop for health insurance at competitive prices. Now, for those individuals and small businesses who still can't afford the lower-priced insurance available in the exchange, we'll provide tax credits, the size of which will be based on your need. For those Americans who can't get insurance today because they have pre-existing medical conditions, we will immediately offer low-cost coverage that will protect you against financial ruin if you become seriously ill. But an additional step we can take to keep insurance companies honest is by making a not-for-profit public option available in the insurance exchange. Let me be clear, it would only be an option for those who don't have insurance. No one would be forced to choose it. It would also keep pressure on private insurers to keep their policies affordable and treat their customers better. I will not sign a plan that adds one dime to our deficits, either now or in the future. We've estimated that most of this plan can be paid for by finding savings within the existing healthcare system, a system that is currently full of waste and abuse. The only thing this plan would eliminate is the hundreds of billions of dollars in waste and fraud, as well as unwarranted subsidies in Medicare that go to insurance companies. And we will also create an independent commission of doctors and medical experts charged with identifying more waste in the years ahead. These steps will ensure that you, America's seniors, get the benefits you've been promised. And we can use some of the savings to fill the gap in coverage that forces too many seniors to pay thousands of dollars a year out of their own pockets for prescription drugs. Reforming our medical malpractice laws can help bring down the costs of health care. I know that the Bush administration considered authorizing demonstration projects in individual states. I think it's a good idea.